So I'm going to back up just a little bit. So when our phase 1 and phase 2, I'm going to put my bloodstream here. When this xenobiotic goes in here, if this particular enzyme is necessary to bind up this xenobiotic, and it's being blocked by a drug or some type of chemical, what's going to happen?
It's going to spit it back.
Okay. Now, it's spit it back if it's in the enterocyte, but this is the liver. So it's still a very dangerous product. So what it's going to do, it's going to damage your liver. Okay. And it's going to continue to damage your liver until the body can figure some way to get it out of there. Okay. Now, so what we want to try to do is, number one, don't take any chemicals or drugs that we knowingly are going to block pathways that are going to detox certain things. But we have an 87,000 chemical deficit we're starting with, so sometimes we just don't know. So now you can understand why we try to get you off of these drugs if we can. If you have to take Tagamet, or you have to take one of the hydrogen proton blockers because your stomach's being eaten up, you take it as short a period as humanly possible, and you alter your diet and you watch what you're doing so you don't put yourself at risk to damage your liver. People on this stuff for years. Tagamet blocks every single solitary one of them. How many of y'all know somebody been on Tagamet for 15 years? You think they're loading up with toxins? They'll blow up one day. And I mean literally, blow up. Okay, so what do we want to do to try to help this along? There are things that are necessary to help this process because all of these enzymes require cofactors, and the cofactors are called vitamins and minerals. That's what these things use to work. And so when I'm always telling you, have you taken your multivitamin, have you taken this? The reason why we're doing that is not just because we want to make you take vitamins, we want to make these cofactors work. And you're living in we're literally living in a cesspool of toxins. And if you don't have the right vitamins and you don't have the right minerals, this flat isn't going to work. Not only if this is broken, it won't work. If this needs vitamin B2 and you don't have enough of it, or you run out of it, guess what happens? It won't work either. And the B vitamins are critically important. Amino acids are important. N-acetylcysteine is important. Glutathione is probably the most important one of all. It's an amino acid. So B2, B1, B5, all of them. And sometimes we'll even do individual vitamins and I've noticed it's experimenting is some folks can take an individual B vitamin, or more of it if they have a toxic situation, and they'll do better. Because their body not only needs all the B vitamins, but it might need a B5 or a B2 or a B1 more than it does anything else because it's running out because it's detoxing a particular toxin. Okay? So in order for this to be bound up, it takes vitamins, minerals, and amino acids. And all of those have to be in perfect harmony to get over there. And the thing about vitamins and minerals, like, they come and go out of the body. And if you don't eat at it, you're not going to get enough when you're in a detox state. In a city like Houston, the concept of not taking nutrients and not taking vitamins, in my opinion, is just stupid. You're never going to catch up. And we had a big thing this weekend on that about how our food supply is getting so weak with nutrients and the pesticides. I'm going to give you some little clues here in a little bit. So this is very, very important. We also can use different chemicals to test. Okay. Just some kind of side things. Everybody understand that? So let me just review real quick, and I'm going to do it on just a global thing. We've got a liver, and we've got a bloodstream. We're going to put a xenobiotic out here, and then bloodstream again, and then the blood's going to go to the colon and put a kidney here. Okay. Now, it also comes out of the sweat. It also comes out of the lungs, all your teardrops. I had a patient one time that was severely mercury poisoned, and we actually measured her teardrops, and it was loaded with mercury. So, and also palladium and other things like that she had in those breast implants. So let's review. Liver. So you got a xenobiotic, it goes into the system, it goes into the blood, it gets captured, it's brought into here. So you get phase 1 and phase 2, and it's locked up, goes over here, makes it water soluble, makes it safe, goes into the blood, it goes down either into the feces or it goes down into the kidney, and you eliminate it from the body. I'm not going to cover those other ones, it's too complicated. That's our general review. For our liver, we want B complex. All the B's individually, 1, 2, 5, 6, all of them. And then we want amino acids. And a bunch of other stuff too. Now all of this is controlled by your genetic pool and your nervous system. And that's why we adjust you. We try to normalize the nervous system. And your genetic pool can also be damaged by these products too, but your genes and all that make it go. And they said we were a amoeba one time. I don't believe it. It's kind of complicated, isn't it? So that's a basic review of your detox use system. I'm not going to get heavy into detox and prescription drugs and all that because that science has been well studied. You can look into your PDR, and it will tell you which enzyme systems are being inhibited from the P450 inhibition, and doctors know this stuff. Now, why we don't pay attention to it more acutely, so to speak, I don't know. But most of the medications that are out there, you really need to know if it's affecting your liver in any way. By the way, standard liver test will not show up when you start having these type of failures. So your liver enzymes are not going to go up, they're not going to go down. Until the liver gets damaged to the point where the liver enzymes actually go down, you start getting fatty liver and cirrhosis. Okay, so looking at standard tests doesn't do you much good. Okay. The next thing I want to do is talk basically about what are we going to do about it. Since we don't have answers to all the chemicals, we can't control China, we can't control all these countries, and this stuff is floating over here by the tons. We're not the major polluter in America. It's these other countries are just dumping this stuff in the air and it's coming over. We're very clean in America, actually. So what we do is we're going to take a global approach. We want first is to get away from these plastic water bottles, carry them around all day long. Get a glass bottle. And the second thing is get RO water, reverse osmosis water. Everyone should be reverse osmosis. Don't drink that water. Y'all want to scare yourself on water, just go down and take a tour of the water plant like I did. It comes in, they put ferric sulfide in there, they drop all the solutes out, they throw some chlorine in there, and they pump it to your house. Now, remember our criteria was, and I don't know if I said this earlier, the way we measure toxins, it's got to kill you quick. Very quick. And the same thing with drugs. It's got to kill you within a certain amount of time, a certain dosage. If it kills you slowly, it's okay. So they allow all these pesticides. Call the EPA and ask them to give you a report of how many pesticides and chemicals are in the Houston water. You remember I did that modeling not long ago? They sent me a book about this thick. And it's like, whoa. So, and even if you have problems with any type of things like ADD, someone has Parkinson's, you have any kind of health issues at all, get a carbon filter in your shower. Filter as much of it as you can out, especially with the kids if you have sensitive skin. Reverse osmosis of water, drink that, use it to make your soups and juices and all that kind of stuff. Don't cook in plastic. When you cook in plastic, all these BPAs and all these chemicals will come out. You just don't want them. And you don't know which one might do you in. You may be able to pass them out, you may have the enzymes, but you may not. There's no way to know, so we just take these general precautions. Don't store food in hot plastic containers. Avoid flame retardant chemicals. Don't use sunscreen. Get you a natural sunscreen. Don't use these chemicals. Remember our study we had earlier? Within 2 hours, the chemicals are in your body. Avoid plastic bottles to feed your infant. Go back to glass. All of the doctors who do IV therapy and natural medicine, they all use glass bottles if it's long-term therapy, because they don't want to get these xenobiotics in their patients. Avoid canned foods if possible. Don't use pesticides around your home unless it's absolutely necessary. I'm going to tell you a story Dr. Merkel told this weekend. And some of you may have heard if you saw me this week. There was a patient of his that was very deathly ill. They ran every test known to mankind. Every doctor ran every test, and they just couldn't find anything. And he went and told her, he said, I don't know what's going on. What have you done in your life? And she said, well, nothing, really. And she said, what have you done anything new in 6 months since you've been sick? She said, nothing. I have a new home. And she said, well, tell me about your house. And so she said, it's a wonderful house. It's great. It's clean, pretty. And matter of fact, I mean, it's so clean that one day a roach came in from outside and it was going down the wall and it just fell on the floor dead. And he said, well, you need to move out of your house. They went and had it tested, and what happened, the person that lived there before had saturated the home with pesticides so much, you couldn't smell it anymore, but stuff was fumigating out of the, and it was making her sick. She sold the home and she's doing fairly well today. So you don't always know. Consume organic foods if possible, and one of the things nobody thinks about, but try to use pure soaps, shampoos. The stuff from China, what was in the news not long ago? What was in all the shampoos and toys and everything from China? Lead, what else? Mercury, the most neurotoxic substance we have running around. It's illegal to use in anything in medicine anymore, except for dentistry, of course. But all that stuff. So you don't want to, and when you heat that stuff up, it gets bad. So these are general considerations that we want to do. Okay, and of course you want to come get an annual physical and get checked up and all that kind of stuff. We can watch trends. As I track you guys and I get to know you over the years, I watch your blood work and I watch what you're doing. I look at you in your skin and your eyes and all that, and I just see what's the trend. Are you trending good or are you trending bad? And sometimes, again, we don't know what your genetic makeup is. Maybe one day we'll have a gene pool map of every one of us, and we'll know, oh, you can't handle this chemical, you can't handle this chemical. But right now we don't have that. We're way, way away from that, so we have to take general precautions. Okay, any questions?
We got a place out in the country, and I'm amazed at how much herbicides are used. You mentioned a lot of pesticides, but the herbicides today, they're recommended, they can spray and the cattle can eat the vegetation, or cows get milk. There's no wait for rain to wash it off or anything.
Right. Y'all heard what he said? The cows eat the pesticides on it. Now, something to understand about herbicides, not herbicides, but insecticides, is that an insect has a skeleton on the outside of his body. And they use neurotoxins to kill these things. A neurotoxin is a nerve gas, basically. So, for example, you get gas with a nerve gas, it doesn't bubble you up or burn you up. All of a sudden, your nervous system just stops and you can't breathe anymore. You just die. these little insects, they carry their skeleton, their bones are on the outside of their body, not the inside. That's how come you step on them and go like that, you know. It's like having a skeleton on the outside. Well, you got to penetrate that to kill that little dude, and it's a pretty tough little covering. But so they use nerve agents. So when you're like spraying all over the place with these insects, if your body happens to, when it gets into you, it's damaging your nervous system until it gets detoxed out. If you can't get it detoxed out because of one of these issues like this, you're literally poisoning yourself with a nerve toxin. And the herbicides, what he said is herbicides kill weeds, and that cows are eating them and everything. It's going right into the milk, going right into the meat, and you're getting it. And remember, if the cows eat it, that's just one way. If it's not in the food, it's in the food, but it's not in the water, and it's not in the residential, and it's not in the commercial, so it wouldn't be tested. I scared y'all to death tonight, didn't I? So, personally, I like to see someone on a small, slow detox all of their life. That's why I recommend everyone 3,000 vitamins. 3,000 milligrams of vitamin C every day, you know, complement of multivitamins and all that stuff. And again, I didn't have time to explain this to all you guys, but I mean, that's what I'm doing it for, is I'm trying to give you enough B vitamins without giving you more than the handful of pills you're already taking. But enough B vitamins to make sure this doesn't shut down because you're missing B1 or B2 or B5. You know, it just doesn't make any sense for the whole thing to shut down because you didn't take enough vitamins. And all you got to do is pop them in your mouth. Or amino acids. You know, a lot of folks don't like to eat meat. They're eating meat full of pesticides. And this thing, and personally, all the environmental doctors that I associate with believe that this right here is what's accounting for this rapid increase in these degenerative diseases like diabetes, hypothyroidism, cancer. Cancer is way up, folks. It's not way down. Statistics are manipulated. It's way up, and it's going to get a lot worse. So we're here to kind of teach you so you can kind of have a basis for why you should do a detox protocol all the time. Any other questions?
Bless you.
Must have been a genius there. Okay, well that's it. I appreciate you all coming. And hopefully
Well,
the
Doc,
CD will come
those
out.
guys on TV that